I'm Clare Knottenbelt. I'm Professor of Small Animal Medicine and Oncology, but also the Clinical Director for the Small Animal Hospital here at Glasgow University.
Now, Claire, this is a pretty amazing building. Could you tell us a little bit about the building and why it looks the way it does?
The building is fantastic. We moved here in September 2009, and what we tried to do was create a building with lots of bright light, lots of vision outdoors, because obviously animals like the outdoors, they like being able to see it. So what we've tried to do is put a lot of glass into the building, but also try and let it blend into the environment here. We're on a beautiful estate out at the Glasgow estate. It's really fantastic, lots of greenery, very big mature trees. So what we've tried to do is make the hospital blend in. So we've got a sloping grass roof so that when you come towards the hospital you barely see it, and then you're greeted by this amazing building covered in stone gabions, which are kind of metal baskets full of sandstone, which gives it a very natural feeling within the environment. And the glass, when you're inside the building, really makes you feel like the indoors is coming inside, which for pets is really reassuring, I think.
Yeah, I was going to ask that. It must be a very calming place for animals to come to as well.
Absolutely. I think when you come in here, we're a very busy hospital, but you get a fantastic sense of calm. The colours we've used are very natural colours, bright colours to give a feeling of positivity and an upbeat feeling, but also clean, bright white areas. So it feels very clean and clinical, but also friendly, lots of natural wood, so that it really feels relaxing and calming for the pets. It doesn't feel like your typical very busy veterinary practice. It has a very calm and professional air about it.
Do you think that the environment that an animal is in has a real effect on its stress levels then, and that's why it's so important to have a welcoming place like this?
Definitely. It's really important that a veterinary hospital feels welcoming. Many of our patients, particularly my patients in oncology, come back time and time again. And what we want to see is happy patients, not scared of coming into the area and into the building. And that's what we see time and time again. We're very fortunate because we're a referral hospital. We don't have the sort of numbers of patients sitting in the waiting room at any one time. And that makes a difference too, because you're not getting animals winding each other up and getting stressed by stressing out each other. And it's also important that it's relaxing for the owners, because they come here when they're extremely worried about what's going to be able to be done for their pet, and we need to make sure that we give that air of calm and professionalism to them as well.
Okay, Claire, well, would it be possible to have a look around then and go through some of the departments here at the hospital?
Absolutely, I can give you the full tour and show you everything that we have, because I'm really proud of the facilities and the staff we have in this hospital. So here we are in the main reception area, which is where clients sit, obviously, and wait for their appointment time. We've got 13 consulting rooms, which is a huge number, and they all back onto this really nice grassy slope. They've got lots of grass, so the animals really very much feel almost like a home environment, standing by the French windows, as opposed to a traditional consulting room. The rooms are quite large, and that's because we're a teaching hospital, so we need to be able to accommodate students within the consulting room, as well as, obviously, the vet and the owner and the pets. And I think the other thing is a lot of our clients come from a long distance, so we need space for family members and friends, because they often bring a group of people along with them on the journey. Up above us here, we have a mezzanine floor, which is a place where clients can relax while they're waiting for things to be done to their pets while they're in the hospital. And it kind of gives the feeling of a ship, it's a bit like a cruise ship in its shape and appearance. It's got bars and these big windows which allow you to look out onto the estate around us. So again, quite a calm and quiet environment for people to wait in.
It is actually very much like a ship, the way it kind of protrudes forward like that. And again, looks very clean and airy and light as well, and just contributes to that calming factor.
Absolutely. I mean, the real benefit here is you're here on a fantastically sunny day, so you're seeing it at its prime. But in the middle of winter even, it feels like a bright space, and you know what it's like in Scotland. We don't often see a lot of bright light in the winter. So being able to kind of use that light by the bright colours and the white walls to kind of reflect and really keep the whole atmosphere as bright as it can be all year round is really important.
This would be the first point of call then for anyone that would come into the hospital, so where would we maybe go next?
Right, so it depends what you've come in with. If you've come in with a dog, you're going to wait in this area. But we do also have a cat waiting room, and that provides a quiet space for the cats, because obviously cats don't like being around dogs very much. So it's just a separate wee space for them to sit and wait for their appointment. And it's got its own little television, so the clients don't have to feel that they're shut away in a little room. They've got entertainment there themselves as well. Once your animal has been seen by a vet in one of the consulting rooms, we will take it into the main body of the hospital. And we've done something a bit differently with our design here, because our consulting rooms sit on one side of the waiting room and our hospital sits on the other. And that's meant we've really maximised the light, and it also means it feels much more relaxed. And the pets are very, very happy about moving through into the hospital area with the staff. They don't worry about it. They're not being taken out the back somewhere strange.
Yeah. Okay, well, let's move on to our next destination.
Okay, so we've just come through some double doors into the treatment area, and this is really very much the hub of the hospital. What you can see here is a double-storey space with a roof light as well. So again, lots of natural light flooding in. And this place is really where we do the basic procedures on the animals. So blood tests, if we're going to do an anaesthetic for a short procedure, or for our imaging services, our x-rays and so forth. These animals kind of congregate here to get the preliminary part of their investigation done. It has kind of everything off it, so we've got little side rooms where we do procedures if animals are fractious, or if it's a noisy procedure and we don't want to disturb the ambience of the whole hospital. We've got a pharmacy where the drugs are stored. We've got an endoscopy unit where we can do endoscopy, which is basically passing a video camera up or down to animals, depending on what you need to see. So a lot of procedures are happening here, and this is really what I think of as the heart of the hospital, because all the other bits kind of are little sections off this main heart.
And what kind of things would be happening right now? We've got a couple of people in the background here.
What we have is an intern who's a junior vet who's here to start specialist training, a resident who's a little bit more experienced who's focusing on very specialist training in one area, and nurses. And we do have a fantastic nursing team here. We wouldn't be able to run the hospital without them. They're responsible for doing many of the basic procedures for us, and obviously the care of the animals in this treatment area, but also in the wards throughout their time in surgery and any other place in the hospital. They're really caring for them at all stages.
Okay, Claire, so where will we go to next?
Well, the next bit of the tour is round to the physiotherapy and wellness centre, which is one of our new areas. We didn't have that in the old hospital, so hopefully you'll find that quite interesting. This isn't too noisy for you. Probably go down that way a bit. Mind the floor, it can be a bit slippy and it's wet.
Now, I can see what looks like a rather large treadmill, but it's also like an aquarium as well.
Absolutely. It's an underwater treadmill, so it does look like a giant fish tank, and then you've got the treadmill underneath. And over on the side there you can see a very big tank, and that contains the water for the treadmill, because the water's reused and recycled for a period of time and then we get rid of it. So it's a bit like a sort of swimming pool that you can fill and empty, and that's exactly what we use it for the dogs. And basically you put the dog into that area, enclosed area, and then the water fills up. Now you can see up on the wall there we've got the little life jackets for every size of dog that you could possibly wish for.
There are large and small jackets there, I can confirm that. So you really are catering for every size of dog there.
Absolutely, we need to be able to, because we have a very big neurology service here that does a lot of surgery on animals with spine problems. So these are animals that are paraplegic or tetraplegic, and a lot of their aftercare relies on getting that physiotherapy going again. The great thing about water is we can use it to float the animals a little bit so that they don't have to carry their whole weight, and the life jackets really help with that. They just provide a little bit of buoyancy for these animals, and that means you can start them moving their limbs in a much more natural way without having to hold their weight. On the converse side, if you've got an animal that's trying to build strength, maybe it's got a problem with its leg, like it's had a cruciate operation or something like that, or it's just looking for increased fitness, agility dogs, that sort of thing, then using water can really help increase increase muscle tone. You know, we've all seen the aerobics classes in the swimming pool, and that's because it provides a degree of resistance, but it also supports you and the animal to prevent joint injuries and so forth. So it's a very clever way of getting increased exercise without damaging your joints.
With the jackets that we have mentioned on the wall, you must have different sizes of dogs going in there, and would you have to adjust the water to the right level then just to make it comfortable for them in there?
Absolutely, we adjust the water for the different types of dog, but also for the same dog at different points in its treatment. So if it's the first time it's in there, it might actually have quite a lot of water high up, really holding the animal up, whereas later on in the treatment the water level will drop, so you're getting the resistance without the supporting effect. So it will change with the animal, but also it will change during that animal's treatment as well. So we can do anything really from, you know, small Yorkshire Terriers right up to Great Danes and so forth. And you use the treadmill, obviously, they don't have to go anywhere. So, you know, if it's a Great Dane, it really is going to fill that aquarium tank pretty full.
I bet it does, yeah.
Whereas, you know, with a small animal, you can literally have the option, if you like, of having them free swimming, basically, whilst they are in the tanks. They can actually swim along without having to use the treadmill at all. And apparently you can do hydrotherapy in rabbits as well, and cats, although cats don't like water, so it's very selective, cats.
I was going to ask you that, if it was available for other animals and cats, but I, being a cat owner myself, I don't think that would be too popular.
No, I think we've all seen sort of many depictions in children's films about cats ending up in water and their real hatred of it. There is one kind of cat, it's called the Turkish van, and it loves swimming. It's a swimming cat, so that would be fine for that. So really cats very, very rarely, unless they are keen swimmers. But rabbits have been done, not here, but at other centres, so we would certainly consider doing rabbits if necessary.
And I guess if you had larger animals, that therapy would be good for them as well, like horses, for example.
Absolutely. We don't have the facilities here, but there are places that do swimming, you know, get horses right into swimming pools and get them swimming, because it's the same principles really, that it just protects the joints from impact, provides that buoyancy, but also increases resistance. So again, for any type of problems with joints or muscles, it can be really, really helpful.
And of course, there is the unmistakable smell of wet dog as well, which we're used to in our office because we have two guide dogs, Lucas and Troy, and whenever they get groomed, they bring back that familiar smell.
Yeah, there is something rather special about wet dog, isn't there? That very homely smell. And I read in a book of quotes that there's nothing more affectionate than a wet dog, and I think that's very true. They always come straight to you, don't they, and give a good big shake. We do have showers also just behind you that we use to rinse off the dogs after they've been in the water, because obviously the water's got a bit of chlorine in it, just like a swimming pool. So we have to be careful that we rinse that right off. So there's a lot of shaking, a lot of wet. As you can see, there's a lot of splashing about on the floor goes on in here as well. So, and yep, the unmistakable odour of wet dog.
Now, where can we go to next in the building?
Right, well the next bit is the second half of physiotherapy, I'm afraid, because obviously we've done the watery bit. We're just going to go pass through the dry part of the physiotherapy. We have two physiotherapists here, both of them with animal qualifications. One's a veterinary nurse physiotherapist, and one was trained as a human physiotherapist with an animal qualification. So we've kind of got them coming from two angles, which is quite exciting. So we'll pass through there, see some of the equipment they use, so that you can get an idea of the other stuff we can do for them.
Now, Claire, there's some treatment going on right now in front of us here. Can you tell us what's happening?
Okay, so Donna, our veterinary nurse specialist in physiotherapy, is just treating a dachshund down there. It's a long-haired dachshund, and is having obviously some massage there, particularly at the back of the back. Dachshunds are very prone to having problems with their spines, unfortunately. You can also see some of the other equipment that we use to try and promote movement in the dogs. So little sort of step-over bars that they can do, rather like small jumps, and the bending poles, the sort of weaving poles like you see in agility classes, and the wooden steps. Now that helps us see what the animals are capable of, and also show that, you know, different ways that we can exercise different parts of their body.
And he looks pretty relaxed right now. Looks like he's enjoying that.
I think they certainly enjoy their physiotherapy. I've sent a number of people up for physiotherapy of the patients I'm dealing with, and they always come out of here looking pretty chipper, sometimes a little bit tired, because it can be hard work doing the physiotherapy. You know, if you've got problems, you've got mobility problems, it's demanding a lot of your muscles. It's a bit like going for a gym workout. You feel good, but you do feel a little bit tired afterwards.
Do you think this is the type of therapy that many pet owners wouldn't think about their pets having initially until, you know, they maybe get older or they have an accident or something that requires it?
Absolutely. I mean, I think there's increasing awareness of physiotherapy for pets out there, and certainly it's something that we're very keen to promote, because there isn't enough information at this point in time to really decide which conditions would benefit from lots of physiotherapy. There's ones we know definitely do, like the spinal problems and so forth, but we're looking to try and get more information about things like cruciate problems, you know, that classic footballer's injury. Do they get better faster with physiotherapy? We think at the moment they probably do, but what we'd like to do is actually be able to quantify that and get some good quality research out that shows one way or the other what's the best thing to do for these animals. And that's the wee dog now, just on a sort of seesaw device, which is very good for if what you're effectively doing is asking the dog to balance in different ways, a bit like being in the back of a car, I think. You know, it's that sort of movement you're going to get.
Sit on that sit on the right-hand side there, not the left.
Oh.
Okay, I think we'll let the little fella get on with his treatment. Thanks very much.
Thank you.